Dear colleagues, this is Cataracta Brunescens, that is brown cataract. Let us observe the surgical steps. The main incision has been placed at its selected site. Now this is a sideboard on the right side of the main incision. In this case, I want to stain the capsule with trypan blue dye underneath an air bubble. This is the air bubble. Now 0.06% trypan blue dye is injected underneath this air bubble. Since this is a hard cataract, I want to do a large rhexis, and this staining of the capsule will help me in doing a large rhexis. In hard cataracts, always we should aim for a large rhexis so that there is no fluid buildup in the capsular bag and there is no burst out of posterior capsule because of fluid buildup. This is another sideboard on the left side of the main incision. Now this is how I do rhexis. I incise the capsule with a 26 gauge bent cystidome right at the anterior pole and make a curved flap, a curved incision. This flap is very easy to hold with a Utrata forceps. Now I go anti-clockwise. I'm going near the margin of the pupil and trying to do a rhexis of about 6.5 millimeter. That's it. So I have done a large rhexis, and now hydrodissection is to be done. I do hydrodissection very gently at multiple points and depress the nucleus frequently. That's it. The nucleus appears to be mobile by this time and it is rotating very nicely. Now viscoelastic substance, in this case I have used only HPMC, that is hydroxypropyl methyl cellulose. It is always better to use viscoat and sodium hyaluronate if the patient can afford and if the surgeon is used to that. Now I am going to make a crater, a central crater, and then I am going to chop it. So I have made the crater to some depth. Now I am increasing the depth of this crater all around. Now I go to Phaco 2 mode. This sculpting, this making of this crater was in Phaco 1 mode. Now this is in Phaco 2 mode. Phaco energy in this case is 85%. Flow rate is 45 ml per minute and vacuum is 450 millimeter of mercury. Now I am going to divide the nucleus into two halves. Here it is. I have been able to divide the nucleus into two halves. And now I want to divide each heminucleus into two parts. And this is one heminucleus and it has, fortunately this cataract is not that leathery. However, if it becomes leathery, then also we have to manage it somehow. And now each fragment is being worked on with ultrasonic energy and it is being removed out of the eye. You can see the brown tinge very clearly in this view. So this is a brunescent cataract or Cataracta Brunescens or brown cataract. This is the last nuclear fragment and I am almost through. This is the last bit of the last fragment. I come out the antechamber. The leakage from the sideboard stops. The antechamber becomes more stable. It also stable and removing the sideboards makes it more stable. the posterior capsule goes backward. Thus, it is very safe if the machine is a good machine. It's better to remove the side port and remove the instrument which goes through the side port, that is chopper, and then emulsify the last bit. In this case I am using bimanual irrigation aspiration for removal of the cortical matter. Yes, now this is hydro polish. Just use the fluid jet to remove the cells, the cortical matter that sticks to the posterior capsule. It has come out very nicely. Now viscoelastic substance is injected. This is again ASPMC. In this case I have selected a hydrophobic acrylic intraocular lens, and here it is. It goes, the leading haptic goes into the capsular bag, and the trailing haptic in this case didn't go into the bag. Now I have to depress it and dial it by the Sinskey hook, and it goes into the capsular bag. Now I place the haptics horizontally so that I can go behind the IOL and remove the viscoelastic substance from the capsular bag. First, I remove the viscoelastic substance from the anterior chamber by this very simple instrument, a 23 gauge direct Simcoe cannula. Now, I remove the viscoelastic substance by irrigating with the irrigating probe of bimanual IA. And then I use both irrigation and aspiration and remove the viscoelastic substance. So in several steps the viscoelastic substance is removed. Now the side ports are hydrated. The side ports are hydrated with BSS so that these wounds become waterproof. The antechamber is formed and the case is concluded. Dear colleagues, we must be very meticulous. We must have a command on hard cataract. If you have a high-end machine, it is easy, but it is very costly. It is very costly not only on cost, the maintenance cost of those machines are huge. So this is a very average machine, Oatley Cataracta 3. No financial interest, but the thing is I want to stress upon is that you can do all surgeries with this instrument. Thank you very much for your attention.